Have advanced directives failed? Hello, my name is Federico Diaz, and I'm going to be taking the no position on this matter. What is an advanced directive? An advanced directive is a document or written statement that reflects a person's wishes regarding medical treatment in the event that they will not be able to speak for themselves. One example of this being is if a patient falls unconscious. Although there is widespread public support for advanced directives, they are rarely consulted or implemented. This is seen as a failure by some who argue against them and want the public to adopt some more recent models. So here's a brief history of advanced directives. In 1969, Lewis Kuttner proposed a living will, a document that would determine the course of medical action that would be taken in case the patient is unable to express their wishes due to certain ailments. As time went on, medical technology advanced. The public was becoming aware of machines that allowed for people to continue breathing with a heartbeat even though they were left unconscious, thus prolonging their lives. This leads to the 1975 Karen Ann Quinlan's case. She was a woman who was left unconscious. This is controversial because people weren't entirely sure whether or not Karen wanted her own life to be prolonged. This led to the California to enact the first laws in approving living wills in 1976. In 1983, the President's Commissions for the Study of Ethical Problems in Medicine and Biomedical and Behavioral Research suggested a new approach to allow for someone else to make the decision on behalf of any patient that was unable to speak for themselves. In 1991, Congress passes the Patient Self-Determination Act, or PSDA. This requires healthcare providers to be reimbursed by Medicare to inform patients about their rights on advanced directives. The purpose of this is to promote the usage of advanced directives. So here are some dilemmas and difficulties and arguments that arise with advanced directives. So one issue, simply put, is signing the will. This is an issue because a lot of families tend to not sign any living wills because it is too difficult for them to sign emotionally, and it is often difficult for some families to be able to understand what their patients want. Another issue is that advanced directives may be very difficult to follow. Usually vaguely written advanced directives may generate vague responses. This is bad because this will stop anyone from moving forward with the patient's actual intentions because no one will exactly know what the patient really wanted. Another argument that was proposed by Christopher James Ryan, quoted below, there is an additional hidden assumption that the affected individuals can accurately estimate this balance from the safety of health and happiness prior to the illness. What he was pretty much saying is that there is an assumption that people think that they know what they want when they're at an early age or early state in health. However, as things get progressively worse, we can't really tell what they would actually want once they are actually ill. Have advanced directives failed? Well, yes, in the past, advanced directives have failed or they weren't implemented correctly. With some of the issues stated before in the previous slide, in a sense they have failed, but that's because of the shortcoming of older models. In fact, newer advanced directives are actually working just fine. An example of this is the Respecting Choices program, which began in La Crosse County in Wisconsin in 1991. They worked to ensure that advanced directives were available in their medical records when needed. They are also trained and educated medical staff about the program in a number of ways, such as making defined roles for physicians or written protocols on how to follow a physician's orders which reflect the patient's preferences. Quality assurance was taken to ensure that the program would continue to improve. For an advanced directive to function properly, it must have some of these elements. They must focus on good care for the patient, documentation, so that when traveling from hospital to hospital, we can have some level of consistency. The timing of the advance directive as well. Similarly to the example given in the last slide, timing is important because people tend to get ill at different times, and depending on how severe the illness is, they want something different in their living will. And also implementation is important as well. It's been highly controversial that a lot of advanced directives were not being implemented, thus rendering them useless. Advanced directives are important to the patient's individual happiness. Using the utilitarian approach, I believe that directives aim to help guide families and medical professionals in the right direction. In reference to the case of Cassandra, who is happiest? We've seen what happens in cases where people do not have the option to choose what they believe is best for them. The courts, the medical facilities, Cassandra and her family all had difficulties coming to a consensus on what course of action should be taken next. Utilitarianism seeks for everyone to have the most happiness. With family members having power to decide what a patient's needs are through their advanced directives, I believe that we would be able to maximize happiness. For Bentham, utility means property in any object whereby it tends to produce benefit, advantage, pleasure, good, or happiness. And through an advanced directive, I think this can be achieved.